Fall means Medicare season. There is help for those struggling to understand what to choose, how to choose, and when to choose. Members First Federal Credit Union is sponsoring this segment. John McAvoy is a health benefits specialist with Members First Insurance Services. Medicare open enrollment begins this Sunday, right?
Yes.
October 15th. That, I'm sure that date is ingrained in your head. Big question, but what do people need to know for this year?
So every year there are plan changes. It's one thing that your current plan should have gotten you a notice of coverage change. Looking out for formulary changes on your prescriptions, co-pays, deductibles, things like that. You want to make sure going into the new year you have all the benefits you need to last for that year.
So you can help walk us through these things. And one of the big points I think that is overwhelming really is medication. Medication costs are a challenge for a lot of folks on Medicare. What are your suggestions for coping with that?
That's true. I always start with the medications actually when I do a review. Because a plan may look really great and have all the bells and whistles, but if your medications that you take daily are not covered or higher cost, it's really not that beneficial. So at Members First Insurance Services, we do have the tools to do a whole formulary run through, and we actually can predict and project your annual costs for the next year. For anyone that may be struggling or taking some high dollar medications, there are assistance programs and discount programs out there that we do make you aware of and kind of run through as well.
So there are other options even beyond your plan. There's other ways
Even beyond a standalone drug plan, a plan with a Medicare Advantage plan, there are options for assistance, discount programs, things like that. We can help navigate that for you too.
Have you seen people really be able to change I don't know what to say, change their choice or be relieved of a lot of that almost debt because you're taking on from Medicare because you're able to find them the right fit for their situation?
It is a great relief to help people. Yeah. One big thing that did change and in the past is they did lower and put a cap on the insulin. I mean, a lot of people that had diabetic issues, it was either do I pay for my medication, my insulin, or my rent, or my car payment, or get food.
That's awful.
So a lot of those things finally have been changed to help. But again, we also, with state, federal programs, discount programs out there, kind of be able to piece it together to really help each individual, because everyone is different with what their needs are.
How does someone reach out and be able to talk with you or another specialist?
Oh, so that's great. So you can go to membersfirst.org/Medicare or stop in any one of our almost 60 branches that we have throughout the state. And we are doing Medicare days that you can actually sign up for a time slot and work with myself or any one of the other agents that we work with.
And this is for anybody. You don't have to be a member? Is
Correct.
That right?
Correct.
Wow.
We're here to provide a service for anyone that has questions about these products. We'd certainly love you to join the Medicare and Members First family, but we're here to review your benefits and show you where and what you can do for 2024.
That can be so helpful to so many people. Thank you so much.
No problem. Thanks for having me.
Good to have you. Yeah. We have more Good Day PA for you on the other side of the break. As we go to break, we thank Members First for sponsoring the previous segment.